So when a patient or a family is interested in hospice, we receive the referral on our end. The referral could come from a physician, the patient themselves, or a family member. Hospice patients are visited by an RN at least once a week, and more often if the patient requires. And our care is really tailored to what the patient needs, and that could change day to day, week to week, month to month. So we are constantly assessing our patients and making sure that we're providing the best care for them that they require. My previous experience in cardiac nursing, 9 years of that has all been in pretty big hospitals. I moved to New York City and worked at a very large medical center down there, and I took care of cardiac patients for a year. I then moved upstate and worked in Albany, and I took care of cardiac patients recovering from surgery there as well for 5 years. It was very stressful work. I was taking care of patients after they recover from cardiac surgery. It is quite touch and go at times, and I considered it to be a high stress environment. Comparing that with hospice nursing, I feel like I have a greater amount of time to spend with my patients, and I'm really, really lucky to have that. I have never once looked at my watch when I was in a patient's home, and I feel like as a hospice nurse, I'm really lucky to have the time to spend with people, and I feel like our group of employees at hospice really strive to meet the patient's needs on many different levels of their lives.
Well, as far as being an LPN for hospice, I can also do personal care, that's showering, shampooing their hair, nails, fingernails, toenails. LPNs do wound care, also like Foley catheters. An LPN will, put in a Foley catheter if needed. Teaching is done by an LPN too on medications to the family and to the patient. Ambulation, help with walking if they choose to do that. Sometimes just sitting with the patient so a loved one can run errands. Reading, puzzles, anything like that you can do also. My first job as an LPN was at the health center. I did deal with patients, brought them to the exam room and set them up for the doctor to come in and see. So that wasn't really what I wanted to do. So then I also worked as an LPN at the nursing home, and that was pretty much just passing medications to the patients and wound care if anybody had wounds that needed to be cared for. There wasn't as much one-on-one with a patient because you're really busy passing out medications. I'm in the home for anywhere from a half hour to an hour, depending on the patient and the needs of the patient. In the nursing home, let's say, you don't really get that connection with the patient. I mean, you know them by name, and you just don't, it's sad to say, you really don't have the time to sit down to get to know these people in the nursing homes.
I chose hospice because I wanted to work in the community that I live in. I feel very privileged that people invite us into their homes and into their everyday lives, and oftentimes some wonderful relationships are developed, and I think I can speak for other people on hospice in saying that we really feel like we do become part of the family when we're seeing patients every week and interacting with their spouses, their children, their pets. So we are very lucky to be allowed into people's homes.
I kind of lean towards hospice because it's more one-on-one and more personal care, which I like. It's not just the patient, I mean, we're there support for the families.
I think when the topic of hospice is broached with people, they often have the misconception that it's a death sentence, and that's just not the case. We have had patients for months We've had patients for close to a year. And in that time, our entire team focuses on improving their quality of life.
Well, I think a lot of times people believe that hospice come in and they're there 24 hours. Hospice is a supportive team. They're not there 24 hours. The hospice aide, they come for an hour or so. And like I said, the LPNs can also provide personal care, and they can also be there for an hour or so. But we aren't there 24 hours a day, 7 days a week. But we do have, the 800 number that can be utilized. And a lot of times it can be resolved over the phone with our triage. And if they feel a visit is warranted, they will send an RN